Bun Bun. Are we good? Okay. So this is Bun Bun. Ooh, she belongs to one of our clients. She's rather old as far as rabbits go, so I'm going to do my best to be as gentle as I possibly can. And once we're done with all of our restraint and all of that stuff, we're actually going to do her laser treatment so that she's not as arthritic. So Bun Bun is a female rabbit. I'm going to, hopefully she'll be a really, really, really good girl and she'll show us and not bounce around too much. There we go. There's her back end. And then there's definitely no testicles. It's okay, girly. I know you're really, really fuzzy, aren't you? It's okay. So there is her back end. Definitely no testicles. Definitely a female bunny. Alright, we're going to roll you back over. Easy. I'm being very, very careful to make sure that her back is supported as much as I possibly can, even though I know that she's not going to jump around too much.
I'll take.
Let's see. So if I were going to be doing a nail trim or anything like that, I would do what I kind of just did, which is kind of flip her up so that her feet are out. And if a doctor was going to be doing an exam on her, you know, eyes, teeth, anything like that, I would just keep her little front feet down with 2 fingers and hold her head up so that we could look at whatever we needed to look at. And this is actually also how I would hold her for a jugular stick if we were going to do that for her. We do actually occasionally check her creatinine levels. So there's a little bit of shaved hair under here, specifically for that reason. So we just keep a little bit of hair shaved under there because sometimes we have to draw blood from her. So this is actually how I would hold her for that as well. Just hold her little feet down, head up. Good girl, Bun Bun. Thank you. Let's see here. For sub-Q injections, kind of like with a cat, I'm gonna just rotate. Okay, maybe I won't rotate her. I'll rotate her this way. Kind of like with a cat, the best place to do that is probably going to be the back of the shoulders. Pick up a little bit of skin, get a little tent going, and rabbit skin is really, really, really thin, so you have to be very careful not to pull too hard. Get a little tent and poke right under there. That's where I would do a sub-Q injection if I was going to do one. We're not going to do one for Bun Bun today, though. She gets lots of medications at home, and I don't want to put her through more than we need to. Like I said, she's kind of old for a rabbit. If we were going to do an intraperitoneal injection, the best way would probably be the restraint that I showed you earlier, or we could actually put her on her side. You're just being such a good girl, Bun Bun. I think that there's probably a lot more trust involved with this particular rabbit than I would probably trust most other rabbits to do. So we could put her on her side for an intraperitoneal. There you go, girly. And if we were doing oral dosing, I personally usually medicate rabbits a little bit like a cat. I'll wrap them up like this, so that all I have is just the head sticking out. And then I would take my syringe and I would go in through the side of the mouth. I'd probably hang onto their head, just kind of tilt it very gently back so that I have access to the mouth. And I would just put my little syringe in through the corner, because right behind those front teeth, fair game. Put a little bit of the syringe in there and just squirt away, because usually we try to stick with liquid medications for these little guys because it's a lot easier to give. Let's see, what else? For rabbits, common disease signs: not eating, not defecating. Those are huge red flags and huge markers. Looking for any kind of discharge from eyes, nose, coughing, difficulty breathing. Bun Bun's respiration rate is somewhere in the astronomical numbers right now because she's really, really, really nervous and scared. I would probably have a really hard time counting her heart rate right now because, again, she's really worried that we're gonna do something absolutely horrible. As far as rabbits go, their husbandry is not too difficult, as long as you're providing them with a good source of hay. They don't need a whole lot in the way of sugars or anything. Some pellets and some hay will usually keep them pretty happy. You don't have to give them all carrots and greens. They do need a good routine source of fiber, so you've got to make sure you keep up with that. Easy, are you leaving? She says I might be running away. And I think that's pretty much everything. We did all of her restraint, so now we're going to do her lasers.